We're here talking to sleep dentist Dr. Paul Serrano about a new improved home sleep test for sleep apnea. And Dr. Serrano, thank you for being with us. And understand that now gone are the days, the times where we had to spend an entire night in a hospital to be tested, right?
Absolutely. An overnight study, a polysomnogram, is really the traditional way of diagnosing the severity and the presence of obstructive sleep apnea. It also checks a lot of other things that really aren't so tightly related to obstructive sleep apnea. So these days, when we're trying to screen people and have some compliance on them actually showing up for their home sleep or for their test, we've developed what they call a home sleep test. That's easy to add to the patient, give them the instructions on how to work it, and it's really diagnostic in finding out who actually has obstructive sleep apnea, primary snoring, or other severities of sleep disorders.
So you basically, you get this fitted to your head, you take it home, and you just go to bed in your own home.
Absolutely. You come into the office, a device is fitted to your head, and you hook it on, and it's as simple as turning it on, and then you basically go home, just go to bed at night, come back the next day, drop it off. It's downloaded into a computer. It prints out exactly what your sleep patterns were, the times that you were apneic or not apneic, and that data is sent to a pulmonologist who interprets it a little further, and we have a very standard, objective diagnosis of obstructive sleep apnea.
Very easy. And so it's a quick, simple, easy way to just get this done.
This will replace overnight studies eventually, we think, just because the compliance is so much better. There's not as much artifact. Artifact is where you go into the hospital and you can't sleep because it's not your bed, the room's not the same as you usually have it, and you don't sleep very well anyway. When you're in your own bed and you're in a position where you're not overly wired and overly observed, you get a better, more realistic idea of what you did during the night.